Pharmacies in San Diego and throughout the state will soon sell birth control pills and patches directly to women without a prescription or doctor's visit. Joining me with how the shift could impact price and health screenings are my guests, KPBS medical correspondent Kenny Goldberg and Dr. Shira Varone, assistant clinical professor of reproductive medicine at UC San Diego. And Dr. Varone, what kind of birth control are we talking about that's going to be sold by pharmacists?
We're talking about hormonal contraceptives that have traditionally been available by prescription only.
So birth control pills,
patches,
patches,
the ring, the patch.
Things like that. Are these the same products that were prescribed by doctors, or are they going to be different in any way?
They'll be the same products.
I say, so exactly the same. Now, Kenny, tell us about this new law, if you would walk us through it. What happens if a woman wants to go, come October, get these, let's say, birth control pills?
Well, they go to a pharmacy, and they'll have to get their blood pressure checked by the pharmacist. Then they'll have to take a health questionnaire. It's 20 questions designed to help them determine if they may be at risk for complications from birth control. And at that point, once they pass those two little tests, then they can go ahead and get the birth control, pay for it, and they're out of there.
And there's no age limit on this, correct?
No,
so
there isn't, and that's consistent with California law, in which minors can access reproductive health services, abortions, be treated for sexually transmitted diseases without parental permission.
So, Dr. Varone, what are some of the medical pros for being able to get your birth control contraceptives over the counter?
Well, the number one benefit would be to decrease rates of unintended pregnancy. When patients are needing to come see their providers in order to refill their prescriptions or get new prescriptions, there's a potential barrier to access there. So in somebody who's already been on birth control pills, if they don't get back to see their doctor in time and they run out of their pills, they traditionally have to get back in to see the doctor, get a new prescription, and that could lead to them missing their doses and becoming pregnant.
What about the cons or maybe arguments against this that you've heard? Like, would it increase STDs, or maybe, you know, people won't go get the health screenings that they're supposed to get when they had to do it before to get a prescription?
Traditionally, that was the thought process that providers had, that if they didn't incentivize their patients to come in for their healthcare screening by making them get their prescription only if they came in for screening, then that would have them lose their patients.
And it didn't happen, though.
And that's not what we see when we've looked at studies.
Lots of research on that. Kenny, do we know if insurance is going to pay for over-the-counter birth control pills?
That's the million-dollar question. The California law doesn't address that. There are two competing measures in the Congress now. One would require insurance companies to pay for these contraceptives. The other would not. Currently, the Affordable Care Act does require insurance companies to pay for all prescription contraceptives, but because these will be available without a prescription, there's that gray area. And I was talking with Dr. Varone, and she was saying that because the medications are technically behind the counter, that pharmacists could still bill for them.
Oh, I see. What about price, Kenny? Other medications have gone over the counter. I'm thinking allergy medicines and things like that. Do you think this will result in a price drop?
If it follows the trend of other drugs, certainly they will. For example, when Prilosec and other these antacid drugs and heartburn drugs were put over the counter, the price did drop pretty precipitously. And I think if it follows those trends, they will drop.
And Dr. Varone, what would you recommend to, let's say, an 18-year-old woman or a woman of any age, really, who wants to get their hormonal birth control through a pharmacist? Do you have certain recommendations? Should they see a doctor first?
I would say that ideally patients should still seek care from a healthcare provider, from their OBGYN or their primary care doctor prior to starting birth control pills if possible. But if they don't have access to that, then they need to be thorough and make sure that they answer their screening questionnaires at the pharmacy correctly so that they can know if they have any contraindications to using birth control pills.
Okay, and just to be clear, this isn't for other birth control like IUDs or things like that, correct?
Right. Those devices need to be placed by a physician in the office, so those are not going to be available.
Okay, and Kenny, we have to wrap on this. What kind of impact do you think this could have on public health here in San Diego County? I'm thinking, didn't we recently see a surge in syphilis and things like that?
We did, but there's a new survey from the CDC that indicates, at least among young people, their contraceptive use is pretty high. So I don't think this will affect that so much, and it's designed to give greater access to birth control. So I think That's the main goal of it.
All right, Dr. Verone and KPBS's Kenny Goldberg, thank you very much.
Thank you for having me.